Yeah, hello everyone. My name's Amrish, co-founder of Biorithm, and we're here to talk about maternity. And there's a big problem in maternity, and I think it's very well known. And the real tragedy of this all is preventable poor outcomes. And the reason it's being driven, it's affordability, closure of sites across the US, geography. But this doesn't allay from the fact that it's preventable. And speaking to our customers, our hospitals, there's very real problems on the ground as well. This is not just a high-level statistical problem. Community hospitals are not getting reimbursed enough for the current modality of care. In-person care is expensive, and it's not covered by Medicaid. Large academic hospitals want to move low-value services out so they can bring more high-value surgeries and scans into the hospital in order not to be inundated. And finally, OB-GYN equipment is expensive. Scan machines, different monitors, and this prevents a lot of hospitals from actually adopting their technology. And so with Biorithm, we've developed a remote fetal and maternal monitoring platform. Let's take the burden off the nursing and clinical staff, move it over to the patients at home where it provides convenience, and we can help both parties at once. And at the heart of this is a remote non-stress test. It's a test done in hospitals, by doctors to determine fetal well-being. And the way it works is, well, I've trained hard for this, as you can see. You put your finger through the hole, and you place it over your navel, and it takes a minute to place for a patient at home. It's entirely been redesigned for the patient at home. And this includes the workflow, automated analytics that enhance the test and reduce the false positives that prevent people from going to hospital unnecessarily. And so this is a monitoring as a service. This is a per patient per month. It is currently reimbursable. There's a code. And this allows the patient and the doctors to schedule as many tests as needed, rather than what's limited by insurance. The good thing about this is that the medical societies are moving away from the old standards of care. They're looking at more personalized care, which includes digital physical hybrid. And this is good for us because you're looking at enhanced reimbursement, decoupling of codes to add more value, and you can look at the next 5 years as a transformation of maternal health. One of the things we've done really well is collect clinical evidence. This is a new modality of care in a new setting. And we've tested the device works. It works head-to-head in a hospital. And we've launched pilots at some of the most prestigious hospitals in the country: Beth, Israel, Texas Children's, and soon to be announced in the West. We've completed a 130-patient pivotal FDA study at Ohio State, and we'll be submitting for the FDA soon. We have an experienced team. There's me, there's Suvendra, who's a former GM of Philips in Asia. Pina's a director of a medical imaging institute in Switzerland. And our clinical team, Vice Chair of Beth Israel, Chair of Texas, global leader in fetal medicine from London. And I think one of the real things that has really struck me is that we're able to solve their problems today. So we're solving high-level clinical problems. Yes, how do we detect fetal distress? How do we do it better? But more importantly, how do we make a difference in the operational management of the hospitals? How do we keep them open? How do we make them more sustainable? And Julian's really been a big part of designing our service so that we can make a difference today in an urgent problem of preventing them from closing down. We're raising $3 million as part of a Series A extension, and would love to talk to anyone who's interested in supporting this. This will drive us towards our FDA application in August. It's a 510K, and we're looking at this driving us to our first $1 million in revenue as well. So, I wanted to end by saying that, you're going to hear hundreds of ways to prevent death, make your life better, but we should be investing a lot more in the one way we're born. Thank you.